quit alkaline. I don't want you to use lithium because you're wasting money, and I don't want you to use rechargeables. You'll also maybe carry a little acetone in here, and we'll talk about intravascular dyes in a minute. And we will store the pediatric slender finger sensor here in this little compartment. So when you power it up, hit the on button. These 4 LEDs should light if it's 100%. Each one of those little LEDs represents, what do you want to do?
I was going to see.
Oh. So when you turn it on, this goes on. You've got each one of these represents 25% of runtime, or 2.5 hours, so a total of 8 to 10 hours continuous. So on, and then as soon as you turn it on, it begins a power-up sequence. When it powers up, it'll first display your pulse ox and your heart rate, and then you'll hit the display button, and then it'll go to the next screen, which is going to be your CO percentage. That could take up to 2 minutes because, again, it's digging deeper into your nail bed to really look at what's there. So that's the startup. Now, understand, when I remove the sensor and take another reading, I don't have to shut it off, and it'll auto-calibrate. So you'll notice it'll alarm, and then it'll auto-calibrate, and it'll go through all these flashing things, so you don't have to send it in like you do chemistry equipment to get it calibrated. It auto-calibrates per patient. Now, if you get an alarm, and we'll talk about alarms in a minute, and you want to silence the alarm for up to 2 minutes, you have to shut the alarm up bell right here, and it shuts it off for up to 2 minutes. Now, when I hit the display, I'm going to now hit 8%. That's what it's showing, and that's your CO percentage. Subtract this from your actual SpO2, and that'll be your true SpO2. Now, you guys have heard of methemoglonemia. That's induced by certain chemicals, anilines, benzenes, nitrates, dapsones. Benzene's a very common drug that that your GI guy is going to do when he wants to do an endoscopy because he wants to numb the back of your throat. That benzene induces methemoglonemia. So methemoglobin is something that we all have, and a very low percentage, because one of the other molecules that transports through the hemoglobin is iron. We need iron. And in its normal ionic state, it's ferrous, and it does a beautiful job of transferring energy. The problem is when you induce methemoglonemia, it changes the ionic state to ferric. And now it locks onto the hemoglobin molecule so hard that it blocks any oxygen from attaching. So we have someone who's got methemoglonemia, pulse ox will read 85%. It won't go above 85%. You'll say 85%, give them oxygen, crank it, flush, 85%. Don't treat the patient for a period of time based on a high elevated methemoglonemia. Besides, when you do an ABG and you see brown blood, they will die unless you administer methylene blue. Methylene blue, what methylene blue does is it changes the ionic state from ferric back to ferrous, and oxygen can now attach to the hemoglobin molecule. That's what the drug is all about. Benzene and nitrates and anilines and dapsones are also present in some of the factories. If you've got a drug company, a lot of times when they're making acetaminophen, they're using certain nitrates and such. And yes, it's all contained, and they have overhead alarms, but if they get a leak, or you get a tanker leak, or you get an overturned thing off the interstate, and now you've got a hazmat, those gases are really bad gases and will cause death if you get around them for a period of time. When you hit the display button again, there's a button called perfusion index. You potentially could use this for capillary refill to time how long it takes after you constrict, but most people aren't using this in pre-hospital for anything. What it really represents is the strength of the pulse. So you've got a couple other things on here. On the left side, it's called SIQ. That's signal confidence. That means that with whatever noise and low perfusion or anything, the higher the signal, the more confident we are that it's a clean signal. PI is perfusion index strength of the pulse. So high PI with a high signal quality means whatever numbers we're going to see, we can be assured that those are right on. We do have optional features. For instance, we can have it where after we turn it on, it shuts off after 5 or 10 or 15 minutes. I prefer to keep it on. You want to shut it off, hit the off button. The other things we could do is we can change alarm limits. The unit factory alarms are anything less than 90% SpO2, alarm. Any heart rate below 50 or above 140, alarm. Anytime you take a sensor off, alarm. Anytime the CO is above 10%, it alarms. So from all those perspectives, you've got some early warning, and of course, if you get an alarm, hit the yellow button, and it'll shut the hell up for 120 seconds. Now, to obtain optimal measurements, we need good finger positioning placement, we need to reduce motion for CO readings, and the intravascular dyes. Now, my wife likes the gel coat, and I love that she likes the gel coat because it stretches out how often you got to get your nails done. But acetone doesn't take off that gel. So if you've got a very shiny gel coat, it could reflect too much of that light and cause an inaccurate reading. Again, treat the patient, see what their symptoms are as such. If they do have the normal nail polish, acetone is a good thing. And then the other thing is altitude-induced hypoxemia. Don't have to worry about that. We're not in the mountains. And then elevated levels of methemoglobin. We talked about that. Excessive ambient light. We talked about that. And then if they don't have a good pulse, you're not getting CO. You're not going to get much of anything. Cleaning. I'm glad you asked that question. To clean it, you take a Cavicide wipe, spray the wipe, wipe it down. Now, easy enough. If you want to switch from adult to pediatric, this goes up like this, and you just plug the new one in.
Back to the wipes.
Yes.
I'm not familiar with that.
Cavicide, just bleach, sodium hypochlorite, any type of spray disinfectant. Just spray.
Quat wipes.
What?
Quat wipes.
Yeah, that'll work. Absolutely. Just want to basically wipe it down.
Okay.
Now, there are going to be situations where you may want to use this also as first-line pulse ox, or you just want to use a disposable sensor because they got into a motor vehicle accident and they're bloodied. And you know, who wants to clean this shit? I mean, who's kidding who? This is where it gets to become like, what were they exposed to? Do we have to run a culture on the stuff that we had to clean? I mean, and you don't want to steam autoclave any of this stuff. I mean, you'll kill it real fast. So, with that in mind, I have lots of samples for you guys. Okay, so do any of these sensors look familiar? You're using infants? Look at the range, guys. 3 to 20. This one sensor will cover your newborn to pediatric. This sensor, this is our most popular. This is your preemie and your adult. If it's a preemie, you put it on their instep. If it's an adult, the only difference with these cloth ones versus our plastic ones is the wire goes on the back side of the finger, not on the front side. Okay, these are great. So those two sensors will cover your entire population. The problem is we've got patients with, no matter what appendage we put it on, Grandpa, we can't get a pulse on. So, one other sensor for you. I hope I didn't give it away. I know I saved something for you guys. You've seen these, right? Patients aren't comfortable with those, I've been finding. Ah, got it. Yes. Perfect. This is the most awesome sensor in the world. It's called the E1. The E1 sensor, unlike the ones that fit on the earlobe, this fits into the clavicocclar. Very comfortable. It's designed for 30 kgs or greater. But here's the thing, rapid desaturation. You know this from cardiac arrest. If I dropped right now, and I'm not going to because you don't want to have to work too hard, it's Monday, right? And you took my pulse ox right before I crashed. How many minutes do you think it would take before you'd see desaturation? 3 to 5 minutes. Because there was blood. There was oxygen in my blood. So when does it start to, it takes 3 to 5 minutes. Here though, if they start to desaturate, you're going to see it right away. And most importantly, what are we trying to preserve when we're resuscitating? The brain. That's an awesome, awesome sensor. They're about $30 a piece. They're not to be used on every patient. They are for patients that no matter what, we can't get a readout on. And that, I think, concludes my presentation. Now, have you guys been hearing about community paramedicine, integrated mobile health care, where paramedics are going to be visiting Aunt Martha and doing wound care and stuff? You haven't heard about that? It's happening big time in Minnesota. In fact, they've got a Medicaid reimbursement now. They're paying $60 an hour. Why is this important? Think about this, guys. We've got some frequent flyers in every community. And every time they come in, besides taxing us, if they're put on a ventilator, they're 10 grand a day. And 7 to 10 days later, if we're successful in weaning them off, they go home. They got a bad lifestyle, they're not taking their meds or whatever, and 3 weeks later they're back again. And that's costing you and me big time. Why do you think the healthcare system's broke? So imagine, if you will, medics going out in the field, doing well checks. This is not just in rural America, in urban America, because Aunt Martha doesn't have a car, didn't remember because she's delirious what meds she's supposed to take. You know, there's a whole host of problems. The goal of our healthcare system, especially the centers, is to keep them out, keep them home. I mean, if you're going to die, I want to die at home. I think everybody wants to die at home. My father-in-law died at home. It's the best thing in the world. Who wants to be in a hospital, like, oh, you know, all messed up, and their livers are starting to fall apart, and now they're getting dialyzed, and oh yeah, that's a quality of life. You know, I've been in this business 35 years, and you get kind of calloused. It's like, you also realize that we're all human beings, and we all have religious and spiritual beliefs, but at the end of the day, quality of life to me is being able to get out of bed and walk around. But CP is a big thing coming. We actually developed a partnership. What? Community paramedicine. And I just want to show you something that we came up with that I think I don't know if it would have an application here per se, because you guys have LifePak monitors, which are terrific. You know, they have all the toys on them. We came up with a cool mid-acuity monitor, and I put it in demo mode just so you can see what it's capable of doing. But this particular model has temporal measurements for the temp. It also has the ability to do end tidal, which I don't think they would use in community paramedicine unless they were doing breathing treatments and such. That's what it does. This thing will do blood pressure, temperature, pulse ox, and end tidal. To take the end tidal, this thing's like $3,500. I can imagine this for BLS providers who are carrying an AED and a King tube. Maybe they would get end tidal, because even though they're doing King tube and they're not paramedics, what are they doing which is really bad? They're hyperventilating their patients. When you blow off all that end tidal, what happens? The pH goes to hell, and then you have some drugs that you want to administer, they have no effect. So in pre-hospital, a lot of damage is done. This solves some of that, but I think this really has a great application. If you had to take a mid-acuity monitor, you want to bring LifePak 15, it weighs 20 some odd pounds, it costs 35 grand. But you don't need 12 lead on for a well care, or do you want to just take blood pressure, pulse ox, temperature, and then you carry a little 4-pound AED in your backpack? To me, you think this thing has a place based on what I told you?
Not here, we have paramedics on call.
Right, because they would have LifePak 15s or Zoll products, but there are some volunteers out there, right?
Yeah, surrounding communities, not ours.
Not yours, right? And that's where this has the greatest application, because they could mount this in an ambulance and then have the possibility of being able to take some vital signs, because because they don't run that often, how good are their assessment skills compared to your paramedics who are out there every day? So just wanted to give you a quick show and tell. It's a cute little monitor.